standing shoulder loop assist. So this is just to show you how unbelievable this is. I was once at this training in California. This is an amazing story. And I was attending the training. And the person who was teaching the training was doing this exercise, this yoga pose, and we were partnering up. And so I'll just show you kind of the movement that happened. So imagine we're sitting on the ground in like in a Janu Shasana, like tree. So imagine we're mirror images of each other, and then she's asking me to bring my hand and then bend your elbow, and so as we're sitting like this, to do this and like to open to each other. So as she's demonstrating and she takes this guy's arm like this, he winces and pulls away, and he starts going, ow, 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 and he's like screaming in agony. And she goes to try to like help him, and he's like, no, oh, and he's just like, and I was literally sitting and watching, and we're all sitting around we were in a circle, and I was just right in front of him. And it was almost like, you know, when something happens and you don't feel like you have any power over it, and all of a sudden I'm like being lifted up towards him, and I'm like standing up. It was kind of like I felt like I was floating on the cloud, and I didn't even think. It just was like something was propelling me to him, and I just went beside him, and I won't say his name, but I said his name, can I help you? And he didn't resist me. And so imagine, so he's here like this, and it was this arm on him. And so he's standing, he's still screaming the whole time. So I just put my hands on him, and I went like this. And I heard this loud clunk, and he went, thank you. Literally, he had dislocated his shoulder. And, you know, I didn't know, but I mean, I was just like, I got goosebumps now just thinking about it. Just by me, I didn't put a lot of pressure, but just knowing what is optimal place for the shoulder, I just put my hands, put a little bit of pressure, and literally clunk. So it just goes to show you how important shoulder loop is when we're in that, because what happened in that thing, he went like this, and he's became, you know, very forward, inferior, anterior, and then with the pressure, it slipped out. And apparently he'd had dislocated his shoulder over years, a couple of times, so he was kind of prone to it, and he was very kyphotic and very rounded. So, you know, he had that pattern. So I gave him some exercises, and he emailed me about 6 months later, and he said, this has helped me so much. This is so fantastic. So this is so great. Anyway, what we can do to help people is amazing. So the assist is basically, we're doing the shoulder loop. So I'll just show it from an angle, and then I'll show you from the other angle. So as we know in shoulder loop, we want the head of the arm bone to move up and back into the shoulder socket, and we want the shoulder blade to be moving down, but we don't want the arm to move down. So we're basically assisting that direction. When we don't have enough shoulder loop, we're doing this. This is coming down and forward, and the shoulder blade is coming off the back. So we're literally doing the opposite with our hands. We can cue it, but we can do it manually. So the heel of my hand is going to go with the very bottom of the shoulder blade. So I'll just show from this angle. So there's the bottom of the shoulder blade. The heel of my hand is going there, and my fingers are pointing up. I'll show you all angles. And then here, the fingers are both pointing up. And now on this hand, I'm not on the collarbones because I'm not trying to push this back. That would be icky, owie. So we're trying to move just the humerus. So my hand's on the humerus alone, not on the collarbones. So that's important. And then so basically my hands are not on the same train track. My hands are on two separate train tracks, and they're not trying to pull the train tracks towards each other. I'm trying to bring the shoulder blade this way, and I'm trying to bring the humerus this way. So almost like imagine a wheel, and literally when I do it, it's almost like this movement that I do, and I don't change my hand. I'm just literally going like this. You're keeping that position, but on two separate train tracks. Because if you try to push the hands towards each other, you're going to impinge into the joint, and that can be not good. So hand on the shoulder blade, hand on the humerus, and then I can use my arm. So I don't want this, if this hand drops back or falls back, the head of the humerus seesaw principle will bring it forward. So I want this to stay slightly forward, so I'm going to just stop it with my body. So we take a deep breath in, side body long, exhale, soften. Okay, so now I've got her in a nice position. Now on the next one, we're going to take a deep breath in and exhale. And then I exaggerate the loop. So she's going to go a little bit into a back bend because we're exaggerating it to bring the pendulum the opposite direction of where it's been for so many hours and years. And I'll just show you now from the other side. Okay, so same thing, hand here, so you can get that whole shoulder blade, fingers pointing up, and I've got the humerus, and I'm not like using the heel of my hand and being pokey, I got the whole hand. Get my body in, take a deep breath in, exhale. So all I'm doing is leveraging myself, and I'm going like this. My whole upper body is moving, and she's just moving with my hands. One more time. Exhale. Feels good?